तुम जो इकरार मोहब्बत से गुरेजा हो तो सुनो, लब खुलेंगे तो शिकायत की सदा आएगी। तुम मेरे साथ किसी तौर बात करो, गैर होने से तो बेहतर है चलो एक बने, एक नया अहद करें, भूले पुराना पैमा। लब अगर साथ न दे तो बात करें आंखों से, लफ्ज मुहताजे ज़बान होते नहीं है जाना। तुम किसी तौर मेरे साथ कोई बात करो, बात करने से गिले दूर हुआ करते हैं, बात में लफ्ज मोहब्बत के मिला करते हैं, लफ्ज में इश्क के जादू भी चला करते हैं, अजनबी होने के एहसास मिटा करते हैं। तुम किसी तौर मेरे साथ कोई बात करो। मेरे महबूब नबी कोई इशारा ही तुझसे, ऐ भूले जा मेरे होने की निशानी तुझसे। मौसमे गुल भी तेरा, फसले खजा भी तेरी, मेरी आवाज के सहराओं में पानी तुझसे। तुझसे ही मेरी तमन्नाओं ने वुसअत पाई, आंख के रंग ज़मात के बानी तुझसे। तुझसे ही लिया आंखों ने रंग परखने का हुनर, लफ्ज की जादूगरी नुक्त में जानी तुझसे। तू जो चाहे तो समंदर को किनारा कर दे, ख्वाब के वक्त में पैदा होकर आनी तुझसे। For recital of the Holy Quran, I will implore Dr. Hafiz Sajid to come on the stage.
والعصر إن الإنسان لفي خسر إلا الذين آمنوا وعملوا الصالحات وتواصوا بالحق وتواصوا بالصبر صدق الله العظيم. شروع اللہ کے نام سے جو بڑا مہربان والا نہایت رحم کرنے والا ہے. قسم ہے اس والے کی انسان خسارے میں ہے مگر وہ جو ایمان لائے اور نیک عمل کیے اور صبر کی تلقین کرتے رہے اور سب حق بات کی تلقین کرتے رہے اور صبر کی تلقین کرتے
رہے. اے شعائیں سحر تازہ میرے سال کی سو، میرے سینے میں دھڑکتی ہے ابھی درد کی لو. میری آنکھوں میں شکستہ ہیں ابھی رات کے خواب، میرے دل پر ہے ابھی بھی شعلہ غم کا پرتو. جا بجا زخم تمنا کہ میری خاک میں ہیں، کیا ابھی اور بھی ناوک کفے افلاق میں ہے. ہر نئے سال کی آمد پہ یہ خوش فہم تیرے پھر سے آراستہ کرتے ہیں در و بام اپنے، پھر سے مبادہ ارادوں کو تسلی دے لیں. ہم بھلا دیتے ہیں کچھ دیر وہ آلات اپنے، گلشدہ شمعوں کو ہم پھر سے جلا دیتے ہیں، پھر سے ویرانی شب کو دعا دیتے ہیں. یوں ہر سال میرے دیس کی خلقت پھر سے ادوار کی انبار میں ڈب جاتی ہے. خود فریبی کے تبسم کو سجا لینے سے شدت گرم بلا چہروں سے چھپ جاتی ہے. منزل شوق کا کوئی بھی دل دادا نہیں، وہ تھکن ہے کہ مسافر سفر آبادہ نہیں. ایک نظر دیکھ یہ امور در امور غلام جو فقط شومی قسمت سے وابستہ ہیں، ان کو بھی تو کچھ بجز وعدہ فردا نہ ملا، یہ جو خود ساختہ زنجیر سے وابستہ ہیں. ان کا ایک ایک نفس بھی رین ہے اغیار کے پاس، اب تو غمخوار بھی آتے نہیں بیمار کے پاس. اے نئے سال کروں میں بھی سوالت تیرا، तू दिल से मेरे अगर चाक दवाई ले ले, मैं उस सुबह दरक्षा को तमंदर जानूं, जो मेरे हाथ से कश्कों में गदाई ले ले, जो मेरी खाक को मस्त में बिंदार करे, जो मेरे कश्क वफा को गुलो गुलजार करे। So, in this कश्क वफा जो आज गुलो गुलजार है, we have imagined, projected and brought into being this new concept of lively and clinical meeting, which is the coordination meeting of 2022. Certainly, it is the brainchild of Professor Haja Afzal Hussain, who has been very phenomenal and astounding in holding today's meeting, and certainly he has blended the inner world with the harsh realities around us. For incorporating the clinical cases, I will invite that personage. हर ताज़ा नई खुशबू में लिखा जाता है, बाप एक और मोहब्बत का खुदा चाहता है। रेत ही है मेरे दिल में ए मुसाफिर मेरे, और ये सहरा कोई नक्शे कफे पा चाहता है। दिन ने रात को मान दिया है मुकद्दर लेकर, कि अब रात के पहलों में कोई दिया चाहता है। प्रोफेसर हाजा अफजल हुसैन, donning the roles as Professor of Pediatrics, Children's Hospital, Faisalabad.
Thank you, Gurai Sahab, EPA, office bearers, my dear colleagues, and the staff of Children's Hospital, the administration. Assalamu alaikum. It was really a challenge to change the paradigm from the lectures to the clinical scenario. And we being clinicians, our job is to examine the patients, investigate, diagnose, and then the treatment process comes. And the objective of this change of paradigm was that we being clinicians and our colleagues in this, we should start this tradition of making things go on time. That is the essence of Children's Hospital, Faisalabad. So I'll not waste any time, and I'd like to invite Dr. Anwar from the Pediatric Medicine Department. I would like to also welcome our guests. Altaf Sheikh sir, please. So Dr. Anwar, kindly present your case.
Headache and vomiting for the last 15 days, and pinhole deviation in the left eye for the last 10 days. Headache was generalized more in the early morning, relieved by vomiting, from 3 to 4 episodes per day. Non-villous projectile containing food particles through half the cup in the mouth. And we also noticed pinhole deviation of the left eye for the last 10 days. There was no history of fever, weakness of any part of the body, fits, bleeding sinus, as discharge, and arteries and so forth. There was no history of trauma of the oral cavity and headache, no history of fatal fall, redness of eye, running pain, pain of stomach, and urinary complaints, and narrow distribution of eye. Patient also has a history of pica, when leaking a small liquid of dust is the age of 1 year, and also the dust was stored badly laden material in the upper story of his house. There is also history of constipation for the last 6 months and irritability and behavior disturbance of mercury, which was above 96 percentile for his age. Temperature, child was airflow and saturation of 97%, height of 94 centimeters, was at 60 percentile, weight 12 kg, was at 3rd percentile. His OFC was 49 centimeters. There was obvious pallor, but no jaundice, clear and thought condition was normal. VCP scar mark was present, anterior frontal was closed, the rest of them physical condition was normal. On CNS examination, bulb was normal, tone was normal, power was 5/5 in all the four limbs, reflexive was elicitable, right quadrant was ongoing, left was withdrawal. Signs of
MR images the differential could be encephalitis, toxin poisoning, stroke, and metabolic derangements. We cannot differentiate on the basis of on these imaging between them. Further, MRI brain with IV contrast, visual weighted images, and MRS will be helpful for further. Thank you.
blood red levels were 47.14 nanogram per deciliter. And immediate chelation probably was started. Depenicillin form of depenicillin at a dose of 10 mg per kg per day, well orally, along with iron supplementation. Parents were advised to provide lead-free environment to the child, which they did by complete partition of upper story from the lower story. Patient was discharged on the 10th day and is scheduled for follow-up after 2 weeks with blood red levels so that we can readjust the dose. Protocol is the depenicillin at a dose of 10 mg per kg per day for 2 weeks. Then dose is increased to 25 to 40 mg per day divided 12 orally for 12 to 20 weeks. Now I would like to invite Dr. Patan for literature review.
An interesting case and a common problem because in our setup, social setup, our workplace and our office are the same because you can see in the house where they are residing, they are storing most of their materials and that has led to the mulching of the child. So how often it is common, I'm not going to take long time, I'm just trying to use of this health problem. Actually, you don't see much of it, only the lead batteries and some industrial areas, but earlier in the part of the century, lead plumbism used to be due to the bad plumbing and the pipes that used to corrode, and we used to increase lead levels. Secondly, gasoline that was used, it had high lead levels. Then in certain industry and other, so these are the sources of it that can be lead poisoning, and water and air, gasoline, soil. There are certain woods that are being used. That is also lead. And then there's some paints were the notorious cause in old houses. Now the lead levels are very much reduced in paints. And this was a study of plumbism in Karachi that also showed some CNS and involvement. I would not again go into the details because the time is important and we are running short of time. And these were the levels. There are certain levels beyond which you have to go for treatment of the patient. The levels are quite high. You may go into in literature is reported if it goes in the USA, the level goes over 180 or 90. There have been reports of deaths that high levels. But if the levels are around over 40 or more, then they would be requiring treatment. And on 47, there would be signs of increase in depression. So, if we start the treatment early or appreciate the patient that had been taken earlier, we would have avoided it. The other sources, because now there are limitations of the test being available. Earlier, our firm was doing it, and now when we wanted to read these levels, they have stopped doing it because of some technical reasons. And now we have found out that they are available now. And sometimes these tests are not cheap. the Thai lab is asking for 22,000. Earlier, I think we got the levels done between 10 and 15,000 rupees. And first of all, it is the availability of the test. You have to confirm. We mostly rely on clinical history and then on the radiological appearance that the deposit of lead levels in the metathesis that Dr. Dushasman has given. These are some clinical levels that what would be the mild to moderate and severe presentation. The severe there would be encephalopathy and coma or sensory ataxia, coordination, papillary. In our case, patient there was no. If the lead levels are high, the patient may be hyperactive. Rather, they would be diagnosed as ADHD maybe at times. If they have lead levels high, maybe methylphenidate is also added in addition to the treatment for lead. And the other part which we are lagging behind is the availability of the drugs that are used for the treatment of lead poisoning. So, what are the management guidelines that we would like to screen the patients who live in these old houses, who are exposed to these high lead levels in the form of gasoline or gold, and they are in low socio-economic strata, and maybe in farm houses, they would present with iron deficiency anemia, mostly microcytic hypertonia, and then what treatment do we offer? Ideally, if it is Saxima is available, it is not available in Pakistan. EDTA is also not available for treatment. British anti-levite larvicide, that is dermatophore. The only drug available, that is also not very easily available. We are using for Wilson also. D-penicillamine is also not available over the counter. We have to ask for it at special places. Unfortunately, the drug regulatory authority should make available these drugs which are for specific patients. So where would they go for? I forgot his name. He's always been very instrumental in pointing out the doctor's problem in Mayo Hospital. He has gone. He has caused me. He has gone for a writ petition with the draft. That is a good thing which he is doing to get these drugs registered. Like we are using drugs for the patients of congenital adrenal hyperplasia, hydrocortisone, fluorocortisone, they were not available. And the actual price, if it is, let's say, 100 rupees, and they are charging 10,000 and so much. And those people who are making it available, it is the plight of the patient. They have to get it for the treatment towards a lifelong treatment. So we wish that these drugs are available, or we wish that in the near future we would also have a poisoning center. Like in the advanced world we have, if there is a case of poisoning and we are not, we have diagnostic problems like getting the tests done. So they should help us, like the poisoning center, they should advise us round the clock, and they should make the antidotes also available. I wish that it would be available soon. So we treated the patient with penicillin. Dr. Anwar has already told you the dosage of this, and we require it for a longer period of time. We have summoned this patient. I think he would be available in the next week, and we would like to repeat his levels and keep him in the follow-up. The best thing is that you would avoid first is the prevention. Take the patient away from the source, and in the case of pica and constipation, it comes to our mind, and this case of microcytic hypochromic anemia, we would like to probe it at the case of lead poisoning. Thank you very much. Any queries, questions? Sir.
I think there is very useful mnemonic is also for this.
Sir.
A, B, C, D, E, F, G, H. So for A stand for anorexia, anemia, asthenia. B stand for disability, and blue line on the graph. C stand for concentration and falling. D stand for dystrophy. E stand for encephalopathy. F stand for foul smell from the mouth. then H stand for.
Thank you very much for adding. And the mnemonics are very easy to memorize, and they would be on the desk to remember if there's a rather than shortcut. So thank you very much, sir.
Another thing is, I think in the treatment, this calcium, iron, and zinc should be added because it has been found if they are present in the diet, then this absorption of lead is decreased.
Yes, actually, the enzymes that being interfered at the level, so the calcium levels are also lower because if lead is there, the binding is hampered, and especially the protoporphyrin levels in the erythrocytes are also raised. So these are advanced investigative procedures which are not available with us. But I wish we have, like we have in the Ahan metabolic department, and these poisoning accident and emergency, they would be developed. We have so much wishes that are coming through, and hopefully in the near future, I think these would also be a reality, and our children would be getting. Thank you very much.
Very interesting case. I want to especially emphasize that strict follow-up of these patients is very important. And here the business father.
As you know, this limitation of the resources regarding the investigation. Last time we got it done, but in the last week we had a speaker from Ahan, Dr. Suman is a pathologist. So we tried to get help from him so that he could help us get initial. At the moment they are not doing it. So this was recently checked by Dr. Javeria Khalid that the Shuktai lab is doing it, and I think they are charging 22,000 for this test. Yes, single test. So that's a limitation in a pool setup, social economic setup. What we are diagnosing and what we are doing, I think is still a wonderful job, because other cases which Dr. Nagina is also going to present, you need to do a lot of investigation effort, and there are institutions that would help us and guide us. Next case I would like to, and she's going to present another interesting case, a 3.5 years old child who had presented with fits, and initially it was being managed for fits, and she's going to relate all the events.
Thank you, Professor Amjad Khwaja Sahib and PTA, all the respected colleagues, and we also ultrasonography showed fatty regarding other investigations, ABG, uric acid level, CPK, and echocardiography were normal. So we planned liver biopsy and genetic analysis because patient was having history of AIDS along with she was failure to thrive, marked pedigree on clinical examination, and range transaminases along with severe hypoglycemia and raised triglycerides level. So we did liver biopsy at our department. This is 3B. So the final diagnosis is glycogen storage disease type 3B. We manage this patient after giving dietary modifications, administration of high complex carbohydrates in the form of raw corn starch, 1.6 to 2.5 gram per kg per dose at 4 to 6 hour interval to supply constant glucose and prevent hypoglycemia, especially at night. Calcium, vitamin D supplementation were given, iron supplementation were given, and she was advised to avoid fasting. The current situation is patient is now 6 years old and she is on dietary modifications. She is not taking any anticonvulsant therapy. Epinephrine and the rest are totally stopped, and she is maintaining her blood glucose level. Her fits are totally controlled for last 2.5 years. And she has gained weight of about 4 kg, and weight height is gain is 1 centimeter increase. Here the literature review. First case of glycogen storage disease, type 3, it was reported in 1928 by a Dutch pediatrician, Simon Edgeworth, in 7 years old boy presented with obesity, hepatomegaly, and small genitals. What is the difference between the GST type 3A and 3B? 3A involves liver along with muscles and cardiac muscles, skeletal and cardiac muscles. But in type 3B, only involvement of the liver, as in our case. There are 13 subtypes of glycogen storage disease. This is again a case of glycogen storage disease. Another patient. There are mutations in the AGL genes that are responsible for the production of debranching enzyme. Actually, debranching enzyme is deficient in these patients. So, glycogen is converted into glucose 1-phosphate. It is prohibited here by the absence of debranching, and it causes damage to all the organs. And the patient with type 3A, they can have myopathy along with cardiomyopathy. That's why we perform echocardiogram in this patient that was proved to be normal. There are 4 types of glycogen storage disease: type 3, 3A and 3B I discussed. The more common is type 3A, that is 85%, and type 3C and D, they are extremely rare, and it's because of the loss of activity of the different and indications for ketogenic and manage these patients. We should prevent hypoglycemia. Nutritional guidelines must be explained, and energy must be optimized to reduce the energy level to the muscles and liver. And liver is moderate protein. Here are the few slides. I'm just going to finish. This is the diet you can give. Beef and organ meat, it is not recommended, and these are recommended: fish and lean meat. All foods are recommended, but berries are more recommended because they have less carbohydrates. Canned food or fruit juices, they are not recommended. All kinds of vegetables are recommended except those rather meaty vegetables like sweet potatoes and corn and white potatoes. They are not recommended. For peas, they have more level of glucose that are not recommended. Or olive oil, vegetable oil, flax seeds, nut seeds, they all are recommended. Nuts can be given, but if they are sugar coated, they must be avoided. Low fat dairy products, even though घर का मीट है उसको भी आप the like to have anything use that. For flavored milk or yogurt to have that is not recommended. So the take home message is every kind of is not an epilepsy, and every patient does not need only neurologist evaluation. And proper history, complete examination is the big answer to many unanswered questions. So a bad diagnosis usually means a bad outcome, no matter how serious the condition is. Thank you very much. Thank you my department, thanks to my hospital, DPA and Naveen Pharmaceuticals for arranging this conference. Although she was on many ethical concerns, and she was having different episodes, that's why she's not schooling.
And what about anti-epileptics? Is she still on anti-epileptics?
They are in the department from Children's Hospital.
For last 3 years, she's not getting
facial features कौन से होते हैं?
No, that was the point. She was missed. She was not having मैंने show भी किए थे. ये है अजीब पिक्चर है. ये लाइट ऑफ कर. ये बच्ची है. इसमें कोई इतने वो फीचर्स. ये अभी recent है.
उसमें आप कहते हैं doll like faces, thin legs and body part, and there's the belly tube. So that is typical of type 1. तो इसमें ये है ये नई सिम्टम्स आते हैं। दूसरी एक और बात है कि जो इन्होंने मेंशन की है कि थोड़ा सा पर्टिकुलर वर्कअप और हिस्ट्री दैट इज इम्पोर्टेंट, बिकॉज जो EEG भी होती है वो आई थिंक इट हैज वेरी स्पेसिफिक इंटरप्रिटेशन कि वो आई थिंक द न्यूरोलॉजी पीपल दे आर इन अ बेटर पोजीशन टू कमेंट ऑन इट। तो कहते हैं उसके भी वो पैरामीटर्स होते हैं। जब आप ECG करते हैं तो आप कहते हैं कितने मिलीवोल्ट पे की है, तो दैट मैटर्स। अगर उसकी स्पीड ज़्यादा है तो फिर उसकी वो जो आपका रेट पे फर्क पड़ेगा। ऐसे ही वो तो दूसरी बात ये है नेवर लुक फॉर द लिवर। एक्चुअली जिसने भी उसको क्लिक किया है लिवर तो उनका शुरू से आ जाता है, बिकॉज असल चीज़ है अगर डाइट में इफ यू आर नॉट रिस्ट्रिक्टिंग कार्बोहाइड्रेट्स और स्पेशली कॉर्न स्टार्च देते हैं, हाइपोग्लाइसीमिया अर्ली मॉर्निंग जिसका टिपिकल होता है, तो उसमें अगर इफ दे वर लिटिल केयरफुल तो उसमें आप थोड़ा सा अगर पैल्पेट करें उसका लिवर भी, तो लिवर डेफिनेटली वुड हैव बीन देयर एंड अदर थिंग्स। एनीवे ये तो जो है इस तरह वी आर डूइंग इट और वी लर्न बाय एक्सपीरियंस। लेकिन मकसद तो यही है कि आप एक पेशेंट को अगर कोई प्रॉब्लम हुई है तो इन फ्यूचर वी शुड बेनिफिट फ्रॉम दिस लेसन कि जी उसका थोड़ा सा जिस तरह उन्होंने कहा मेटिकुलस हिस्ट्री ले लें, एग्जामिनेशन करें और इन द राइट डायरेक्शन उसकी इन्वेस्टिगेशंस करवाएं। सिंपल टेस्ट उसके कराते हैं, ब्लड शुगर करवाते और देखते और दे वुड हैव। सबसे इम्पोर्टेंट चीज़ है कि ये अक्ल कुल अल्लाह ताला ने किसी को नहीं दी। वी शुड consult our colleagues and at times the multidisciplinary approach is required. If we consult colleagues, the patient is going to benefit and he is not going to be unnecessarily exposed to the drugs क्योंकि जो ये चीजें देखते हैं कुछ ना कुछ which I think you should describe.
Thank you very much. Encapsulated human structure within the left and if it is extrarenal, it is usually mentioned as edema or an extrarenal neuroblast. Both of the same numerous. Thank you so much.
I don't think it goes on schedule, then I think we would be doing it after the examination. But if it is delayed, then maybe we would be announcing in March, most likely. But we are doing our groundwork and our colleagues are doing really hard work. So I will take this opportunity to announce it. Inshallah, it is going to benefit the ladies of Faisalabad. They don't have to go now to Lahore or some other place. And alhamdulillah, we have perspective because the cases come from all these countries. So we have, and we will invite experts of the subject from Lahore or other places also in order to attract the candidates. So I would like to thank Swan again all our colleagues who have made this meeting a success. And I'd like last from Quresh Saab, if you like to add, and then would like to especially जो है getting this meeting into a ring. For the student. I think we not take time. The lunch is ready. So please. Thank you.
संजोग भूलेंगे शायद की सलाह आई तुम मेरे साथ और बात करो खैर हो बने एक नया अहद करें भूले पुराना पैना